Good day to all CIs from Section A and B. We are Section B from Group Mate, and our word class topic is all about bilateral tubal ligation. And the members are the following: Inkoy Lene Grace, Heriangelina, Haniela Nasha, Lim Hyacinth, Maginsay Laika, Margasa Russell, and Damuku Jubilin. Learning outcomes. At the end of the discussion, learners would be able to define bilateral tubal ligation, discuss the causes of bilateral tubal ligation, enumerate the signs and symptoms of bilateral tubal ligation, identify on how to practice doing the treatment bilateral tubal ligation, acquire knowledge about the topic, and last, learn more skills on how to take care of the patient. Introduction. Barrier techniques, short and long-acting reversible contraception, and permanent sterilization are just a few of the many different contraceptive alternatives available to singles and couples. More than 220 million couples seeking contraception choose sterilization around the world. According to data from the National Survey of the Family Growth, from 2006 to 2010, 47.3% of married couples in the United States use sterilization as their primary method of contraception, followed by tubal ligation at 30.2% and vasectomy at 17.1% for women who have finished having children. Sterilization using tubal ligation is a secure and effective method of contraception. Additionally, tubal ligation might offer non-contraceptive advantages like better menstrual cycles and lower ovarian cancer risk. Definition. Tubal ligation is a surgical procedure for female sterilization in which the fallopian tubes are permanently blocked, clipped, or removed. This prevents the fertilization of eggs by sperms and thus the implementation of a fertilized egg. Tubal ligation is considered a permanent method of sterilization and birth control. What is female voluntary surgical contraception? Is a safe and simple surgical procedure that provides permanent contraception for women who do not want more children. The procedure, also known as bilateral tubal ligation or BTL, involves cutting or blocking the two fallopian tubes, although this section also presents endoscopic approaches to BTL. Standard procedure is the mini-laparotomy under local anesthesia with a light sedation. What are the different methods of female voluntary surgical contraception? Laparoscopic tubal ligation, one of the popular methods of BTL with a success rate for preventing pregnancy in more than 99 out of 100 women. Through the use of a specialized tool called laparoscope, the doctor is able to view the insides of a woman's abdominal cavity and block both fallopian tubes, thus preventing pregnancy. With laparoscopic tubal ligation, a small incision or cut is made just below the umbilicus, through which a metallic tube called a trocar is inserted to access the abdominal cavity. Through the trocar, the laparoscope is inserted, thus enabling the inside of the abdomen to be viewed and the uterus and fallopian tubes to be identified. Coldoscopy, a type of vaginal sterilization procedure, the vaginal approach of tubal ligation once the preferred technique. However, this procedure is associated with higher risk than laparoscopic tubal ligation surgery. Thus, surgeons have been favoring the transabdominal over the transvaginal approach. A major advantage of coldoscopy is that no abdominal incisions are made. Coldoscopy tends to be reserved for obese patients or for women with retroverted uterus. These transvaginal procedures involves a small incisions made through the vaginal wall. However, a coldoscopy may be difficult to perform because it requires a woman to be in a knee to chest position while under local anesthesia. During coldoscopy, an incision is made into the posterior vaginal fornix, the recess behind the cervix. A coldoscope, which is a type of endoscope with light that is used to visualize female pelvic organs, is inserted through the incision in the peritoneal cavity. The coldoscope aids the surgeon in locating the fallopian tubes. The fallopian tubes are pulled through incision into the vagina. The coldoscope is removed and the tubes are closed off, tied, clipped, or sealed shut and put back into place. The incision is then stitched close. A BTL coldoscopy takes about 15 to 30 minutes is performed as an outpatient procedure. Hysteroscopic tubal ligation, long-acting permanent methods. A transcervical sterilization device was approved by the U.S. Food and Drug Administration in 2002. The microinsert is known as Assure. It is placed hysteroscopically to block the fallopian tubes from within the uterine cavity. The insert contains inner polyethylene terephthalate fibers to induce fibrotic reaction and is held in the place by a flexible stainless steel inner coil and outer nickel titanium alloy coil. The device is designed to stimulate tissue growth in and around the insert to form an occlusion of the fallopian tube lumen. The tissue barrier formed prevents sperm from reaching and fertilizing an ovulated egg. It usually takes 3 months before the tubes are considered effectively occluded with the completeness of the blockage, which is confirmed by a hysterosalpingogram. The short-term efficacy rate of this method is equal to or better than that of the other sterilization methods. However, the long-term efficacy rates are still unavailable. This method is not suitable for future reversal. This type of device is not yet commercially available in the Philippines. Etiology and causes. Female sterilization is safe for all women. Women can have BTL or bilateral tubal ligation even during monthly bleeding, as long as she is reasonably certain that she is not pregnant. No medical conditions prevent a woman from using female sterilization. However, some client conditions may limit when, where, or how the female sterilization procedure should be performed. The WHO Medical Eligibility Criteria, or MEC, provide evidence-based recommendation based on client's condition and characteristic. Clinical manifestations, signs, and symptoms. Immediately refer the client to the appropriate health facility when she is experiencing any of the following: pus or bleeding from the wound, abdominal pain, cramping or tenderness that worsens, pain, heat, swelling or redness of the wound that worsens or not subside, fatigue, high fever in the first 4 weeks.